Okay, so we are going to be taking some audience questions during this session. We do have a limited amount of time, and we've had a lot of questions come in for this COVID-19 update, so we're going to get to as many as we can. If you want to ask a question, you can look for the Q&A icon on the right side of your screen, where you can also upvote other people's questions if you also have somebody that asks the same question or that you really like. Please do remember that we're not going to be able to answer questions about anyone's individual cases or symptoms. So we got over 100 questions in advance of ResearchCon, and we really tried to pull out a few key themes for this COVID-19 update. Including things like, what do we know about COVID-19 and CF? How can we protect ourselves? And what happens when our communities start to return to normal? So I'm hoping that we can cover all of these things over the next 30 minutes. And I'm going to ask Dr. Boyle with a simple question to get us started. Can you give us the basics about what everybody should know about COVID-19?
Sure. Thanks, James, and greetings everyone online. It's good to be together. So let's go through some of the key basics for coronavirus and COVID-19. I think some very basics. Probably everybody knows this, but make sure we're on the same page. This is a illness that's caused by coronavirus, which is actually the name for the virus. COVID-19 is actually the name of the disease, right? So the CO is the corona. The VI part is the virus, and the D is disease, so that's COVID. And then 2019, when this actually is first recognized, so that's COVID-19. That the bottom line is that this is an illness which affects the lungs, can make people very sick. The good news is that most people have been able to, who've been infected with this, have been able to do okay with this and actually been able to recover from home. But we know that there's a subset of people who can get particularly ill. The infectivity part is something we're already really familiar with. It's droplets, much like we talk about with Pseudomonas and other CF pathogens. And this means, the 6-foot rule and droplets and surfaces, not air ducts or distant air. And there's been a lot of speculation about that, but most of the evidence is this really is the things that we're used to dealing with in terms of infectivity. We do know that people can be carriers even if they're not symptomatic, which is one of the things we'll talk about is why we need to be extra careful. One thing that's probably important to realize is there's no evidence that people with CF are at more risk for getting COVID-19. We actually are extra careful because we know that there's some increased risk if you have lung disease, and we're going to talk some more about what the experience has been in CF. But it doesn't mean that people with CF are necessarily more susceptible. We know, though, that the way we're going to really limit this is by social distancing, or actually physical distancing, right? So keeping that distance, all the things we've been talking about. The good news is that there has been some effect of this distancing that the U.S. has been practicing. So the plateau in the number of new cases, and that's probably one of the key things to be looking at is the number of new cases each day. That's plateaued since April 4th, which was the peak at about 35,000. But we still have some work to do, definitely still have some work to do. And we know that number is actually even higher in reality because we're not doing all the testing to everybody that's out there. I think what we need to see now is that even as we ramp up that testing, that new case, number of new cases each day stays at, plateaus, it's at 35,000 and starts to come down. That's when we really will start to be able to feel like we're getting ahead of this. And the last basic thing I just think is that right now we don't have known effective therapies, right? That hydroxychloroquine, the azithromycin combination, some of the antivirals show some evidence of benefit. There's over 50 clinical trials actually that have been started in the last week. So we're going to know a lot more. So James, that's probably the basics. And we're going to talk about a lot more detail, but hopefully that gets everybody on the same page.
Okay, thank you very much. So one of the big questions that I know I've had and lots of other CF patients have had has been, how many people with CF do we know about that have had COVID, and what has that experience been like when someone with CF has come down with COVID?
Yes, no, absolutely. This is something we've actually been working hard to stay on top of, and that's been working with our international contacts and also through our registry as well as a chat room, or I should say a board that we post that physicians can post on. We've asked them to try to keep us as updated as possible while still protecting HIPAA. So here's the bottom line with the experience in CF so far. Overall, I would say we've been actually more encouraged than we initially anticipated. So there's a couple of things on that. One is that the number of people worldwide right now is about 50 with CF. We actually update this each Friday, so there may be an update tomorrow. But right now it's probably around 50 or a little over that. That we're aware of 14 people with cystic fibrosis in the United States that have COVID-19. Again, most people have been able to stay home to recover. There's been very few hospitalizations, actually. There has been one death, sadly, that we're aware of. It was a police officer in Chicago. One of the things which I know I shared on a video that went around to the community, but I think it's a really encouraging sign, is that there's been at least 2 people whose FEV1s were below 25% who got COVID-19. I think before this, we would have feared that that would have been it for them. Both of those people have fully recovered from COVID-19. So that is something that's really encouraging. So I would say that obviously we have a long way to go. We have to be really careful. But at the same time, some of the things we originally feared, maybe things are going better than we anticipated. I will mention one other group, James, I'm sure it'll be a question and maybe I'll just address it now, and that is about lung transplantation. That we're actually probably particularly concerned about people who are on immunosuppressants because of lung transplantation. Right now, the numbers are still low for CF and lung transplant, but I can tell you that outside of CF, lung transplant in general, there have been more people who have had COVID-19, and some of those patients have gotten really sick. So that's a group, everybody needs to be careful. People with CF particularly, but the people with lung transplant particularly careful.
Does it seem like people with CF have the same symptoms as the general public with COVID, or is there any difference there?
It's a great question, actually. I would say that right now there's no evidence that the symptoms are any different. This is something we'll be learning a lot more about. Like I say, on Fridays now we have a group that gets together of physicians from around the U.S. as well as some international representatives to try to understand this better. And so far, the typical symptoms of fever, dry cough initially, and sometimes GI symptoms really are not that much different than what we've seen in anybody else who doesn't have CF.
Unfortunately, all of those things sound pretty familiar, so it definitely sounds like a good time to be in contact with your care team if you're not feeling well. Speaking of people with CF and COVID-19, do we have any reason to think that people with CF might actually do better than some of the general population because of, say, the medications that we use, or something I was thinking about the other day was actually really kind of helpful. It occurred to me that, we've had training, a lot of us, in how to do airway clearance and, how to monitor for respiratory symptoms. And we have all these tools that sometimes the general public doesn't access until they're in the hospital. So despite the high risk for us, do you think that gives us a little bit of a reason to be hopeful?
Leg up. I would tell you one thing that absolutely gives the CF community a leg up, and that is experience with the distancing, the social distancing, or what we call the physical distancing. That we've been doing this for years, right? We know how to do it, and so I think one of the reasons why we're seeing numbers right now in CF that may be lower than we initially feared just for people getting COVID-19 is because we know how to do this, right? And so that absolutely gives a leg up. Your question about whether or not medicines from CF could be helpful, I think that's really too early to say. Certainly, when I think about the CFTR modulators, things like Kalydeco and Trikafta, we've seen with other viral illnesses, such as the flu, that people who are on those modulators tend to get through those better than they did before they had them, right? That sometimes people don't need to go on IV antibiotics and maybe go through those. So I think there's a good chance that those could be helping. It's a good question about the other airway clearance. I think it's too early to tell, but it certainly is not going to hurt. I will tell you one thing that I've been thinking a little bit about that might be one thing we haven't seen a lot of in CF is what we call cytokine storm. This is something that you may have read about, that is oftentimes the thing that really causes people with COVID-19 to get sick, where they suddenly will have an overreaction of their immune system. And that oftentimes is the thing that leads people to be hospitalized or even have to go on a ventilator. And you know what, this may be one thing. This is totally a theory on my part right now, but we've been sort of keeping an eye on this, is that people with CF in their bodies are used to already having bacteria in their lungs, and their immune systems don't overreact to that, right? Just think about how often it's pretty rare to get a fever from having, chronic Pseudomonas. And so it may be that some of that cytokine storm, that big immune response to infection in the lungs, may be blunted, and that actually may be helpful. We'll have to see if this holds up over time, but that would be one thing that might be. And, the one thing I would say, though, is particularly with people with low lung function, we still are in places we have to be extra careful. So, when we're reading guidance that talks about vulnerable populations, this is still something we want to be extra careful about until we know more.
So can you clarify something that you said earlier with respect to people with transplants? Are people with transplants getting very sick and surviving, or what do we know about that?
Well, right now the experience with people with CF who had transplants is fairly limited. It's only a couple of people that have been reported, and what I was reflecting is that there have been more reports of people with lung transplants in general, maybe from other diseases. It's a larger number, and some of those have gotten very sick, and some have died. And so that's why I think for lung transplant, particularly because we know of the immunosuppression that's present, that's a group that needs to be extra careful. But for CF and lung transplant, I can't give you specifics right now. We'll obviously be happy to update it as we learn, but it's something we want to be careful about.
Okay, thanks. So the next kind of big theme that we have to deal with is really, what do we do for the CF community? How should we best be protecting themselves? Should I stay inside all the time? Should I be wearing a mask when I'm out in public? All of these questions. Should I be wiping down my groceries when I go to the grocery store? Should I be going to the grocery store?
Yes. No, that's perfect, James. I think that's where the rubber meets the road, is for the real life, right? Because it's easy to say, be careful. One of the things I would say is, I know that everybody wants more guidance than wash your hands and stay, do the distancing and all that. But remember, that is a big deal. That's, a lot of these other things, biggest step is you can limit some of those just by continuing to be very attentive to that. But there's a couple other things that I'll say that I think that, for one thing is, yes, people with CF, actually all of us, but particularly people that have medical conditions and people with CF, should be staying home as much as possible. That's just to minimize the risk right now. That it is okay to go outside in general. And I'm going to talk about a little, maybe the stipulations there, that, I think a lot of this is context and location. So there is, if you're able to go outside, go to a backyard, sit on your front porch, you're not going to have any of the other exposure, I would actually encourage that. There's no evidence that there's risk for that. That's actually probably something that's good for mental health. On the other hand, if you live in Manhattan, and I will say this is my own daughter lives in a small apartment in Manhattan. She doesn't have cystic fibrosis, but she's been staying in her apartment for the last month. She hasn't been going out because she says when I go out into the stairwell, when I go down, I always meet and encounter other people. So I think what I would say is, you can absolutely go outside if the situation allows. If it's a situation where you're going to be encountering other people, then that's something you have to say that may not be a wise thing to do. In terms of the grocery shopping approach, I think one thing, just a little bit of comfort, is that the studies that have shown that coronavirus can continue to remain on bags, those are able to detect that. There's not as much evidence that that's something that really can cause infection, but still we want to be extra careful. So what I would say is that, yes, when you have groceries delivered, if you can leave them outside for a while, remember, just sitting outside for a while actually allows that the coronavirus actually to decrease if there happens to be anything there. Obviously, when you have refrigerated goods, that's not quite as easy. So one of those things would be to go ahead and do a wipe down. Be very careful about your hands. Wear gloves if possible. Throw those away, but then to do your hands, and then to bring those inside. The other question that keeps coming up all the time is masks, and we could probably spend a half an hour talking about this, but I'm going to try to be quick. The bottom line is that there's two types of masks, right? One is true masks. These are N95s, which are protective. Those are the ones the healthcare workers are using, which are protective for the person wearing it. The other is what I would call mask or face coverings. Those are ones which really aren't limiting and filtering the air coming in. that really it's only the N95 that protects you. The other face coverings are designed really to prevent spread. And it should be that when people are going into public where they can encounter other people, that everybody should be wearing face masks or face coverings at this time. Because of the shortage, the N95s right now are going to medical workers for the most part because they're on the front lines, and right now there's really a need for that. And we need to keep them healthy because they're getting exposed all the time. I think that there's going to be a time in the future, once the shortage of N95 masks is less severe, that vulnerable populations, people with cystic fibrosis, will start to wear N95 masks more because they actually do provide protection. The face coverings are great, but the way you think about that is my mask with a face covering, my mask protects you, your mask protects me, right? It's sort of this group effect. The N95s are the ones that over time I think we'll probably see more and more of as they become more available and are more protecting. Because the last thing which keeps coming up, maybe I'll just jump to it right now, is the doctor's appointments. We've sent clear messages to the community, to our care centers, that this is a time for telehealth, remote work. As a matter of fact, the CF Foundation is spending a lot of time right now trying to help telehealth be successful. Some of this is by working with care centers to make sure they have the necessary ability to do telehealth. Another this is going to actually be working to try to provide some of the equipment that people need at home to do telehealth. This is going to play out over the next couple of months, but it's something we're really going to lean into because we think that's a key way to be able to be safe and continue to monitor that CF care. The last part I'll just mention is the emotional health and wellness. This is a challenge, right? This is lasting and it's going to last for a long time. So make sure that you're taking care of yourself and your loved ones. CFF.org, the resource room today, has a lot of suggestions on ways to continue to stay healthy and well.
Great. Quickly, what about family members of people with CF? What if they need to go to work? What should they be doing to keep their loved ones safe?
Yeah, that's a great question, James. And it's actually sort of a tough one, right? Because it's easy to say stay at home as much as possible, but sometimes that's not possible in real life, and may not particularly possible for maybe not just for the person with CF, but the people they're living with. So what we always say is, first of all, can that work be done remotely? If it can, start with that. And that goes for parents, it goes for spouses, it goes for, your roommates, those type of things. When it's not possible, then you need to follow those same approaches of really being attentive to the hand washing, using hand gel, to basically being as careful as possible at distancing wherever that person is so that they can avoid exposure. I think the real question that people have is what happens when people come back into the house. And what I would say here is a lot of that depends on the degree of risk of that job and also how vulnerable the person is with CF. Okay, and so if a person is a physician, a nurse who's going out and is on the front lines taking care, I think that that's actually somebody who may think about really trying to isolate themselves as much as possible from a person with CF when they get home, particularly if that person with CF is vulnerable, very low lung function, or have a history of a lung transplant. And that for somebody who's maybe not quite as a front line, it doesn't need to be quite as attentive to that, but still washing the hands coming in, changing clothes, doing a wipe down of anything that comes in are the ways to be able to do this. There's not a black and white answer here. So I think part of it's assessing the risks and then saying, okay, given the whole picture, how careful do we need to be?
I know that's one reason I've really wanted to advocate for, paid family leave and sick leave, and I really appreciate some of what the CF Foundation is doing that as well. So the next big thing that lots of people have been asking about is...
James, if I could, just because, thank you for bringing that up, because I didn't bring it up, but I think it's a key thing that we are pushing, as you noted, at the foundation to try to be able to say if there's further relief from Congress, that we really make sure that we pay attention to family leave for vulnerable families. And so there's some opportunities. The reason I want to bring this up is there's some opportunities to talk to your congressman, go into CFF.org. There may be some things on the resource section here about ways to be able to advocate for that, because this is going to be something we want to be able to think about making possible as we go forward. So thank you for bringing that up, James.
Yeah, I mean, since we're talking about advocacy, I'm going to pull something that we were going to talk about in a couple of minutes, which is a the question a lot of people have had is they've heard about the potential for there to be a shortage of ventilators or medication, other critical elements of healthcare, and that there's a possibility, especially in some states, that people with CF, because of their serious condition, might be not given access to those if there were a true crisis. Can you comment on that?
That's right. I think you did a good job describing it. Really, right at this point right now, this is a theory that if, and it hasn't actually affected anybody, but we need to be prepared. And that is if the healthcare system got so overwhelmed where hospitals had to make choices about ventilators, what would be the guidelines they'd use? And the truth is, we've reviewed all the guidelines that states have developed for that situation in all 50 states. And the good news is that most of them don't mention CF or advanced lung disease, but some do. And so that could be a cause for concern. Again, this is all theoretical. There's been nobody that we're aware of who's actually been affected by this, but we want to be prepared. And so what we've been doing is actually a couple things. We actually just published in one of the best known lung journals for all physicians to be able to see why it's so important not to think of cystic fibrosis alone as being something that should count against you, right? That's clear. We've published that. I think that's actually maybe even available in the resources section if you're interested in looking at that. We're also joined with other groups, so not just CF, but many people with existing medical conditions, to write letters to all those governors who are from those states with those type of guidelines. I can tell you that people have already, once they started to hear this, have been backing down. My thought is this is unlikely to cause trouble, but we're going to continue to push on. There may be some opportunities if you're online, you're from one of those states, to talk to your representatives. But this is something that Mary Dwight and her advocacy group are working hard on. You can read more about it at cff.org. And I think that we're going to be in pretty good place in this in the upcoming couple of weeks.
Great, thank you. So the big question, I think, for everybody is, now what? How do we get back to normal? And I think one of the themes that I've seen a lot, and something that I've wondered about myself, is some schools are opening back up, in May, or have given a certain time frame. Some communities may start to say, okay, you can go back to normal, but what does that mean for us, people with CF? Should we be trying to go back to normal on the same schedule as everyone else?
Well, James, by the way you're asking that question, I think you're directing the answer that everybody should absolutely be aware of. So you're right. I think we are going to see some states, particularly as things start to slow down a little bit here, some of the spread, well, they'll start to open some things up. This will likely come initially with maybe relaxing some of the stay-at-home orders, but still having rules against gathering, and they'll have rules about wearing face coverings in public. I think a key thing is what you were hinting at, James, and that is that this should not be a signal for people with CF to start to say, hey, let's go, because we know that people with CF, the stakes are higher, right? So I think that we're going to have to think about two different schedules here in some ways. We're going to start off with people who don't have pre-existing conditions, aren't maybe at more risk, who will start to come out, to start to rejoin society, and we're going to have to monitor to see what that looks like. But for people that are at risk, the schedule is going to look different. It's one of the reasons why I think we have to sort of get ready that this is going to last for a while, and that we're going to have to be really confident that things are more under control before we start saying it's a good idea for people with CF to start engage. I don't know exactly how long that's going to take, but it's going to take months. It's going to take months. And I think, there's a couple of key factors that I would say which will really determine the speed that we'll be able to start to move forward with people with CF. The one is how well do people practice social distancing and sort of the continued steps to limit spread, so we can figure out what the prevalence is like in the community, because that's going to be something that we're going to continue to help guide us about when we can actually do this. There's going to be, how do we develop treatments? Are we able to have something that's actually more preventative or a good treatment? Obviously, a vaccine would be the ultimate, but until we make progress there are, like I said, 50 clinical trials going on right now. We have some of the best scientists on this, so we're going to see a lot this summer. And then we're going to also learn more about the experience in CF, because then we can have more confidence about saying, here's the risk, here's what to expect. Here's the thing, though. This is going to take months and months, and it's probably not going to be till next year that we really say that truly the coast is clear, right? We're back to normal. And that's because that's not going to come until we really feel like there's very little, if any, of coronavirus in the community, or that we really have great treatment. And that's going to take a while. So it's one of the reasons why I think is working so hard on making sure that people have some of this support if this drags on for a while.
So maybe do we have to stay home until there's a vaccine? Do we know that yet?
Well, so I think, so what I'm going to say is we're going to have to assess how things are going in the community with this. I don't want to just say that's the whole reason. Certainly a vaccine is a key answer. But this is going to be something we're going to have to see how much under control it is in the community. What's the levels in different communities? What can we do to protect? Do we have therapies that we can do? There may be some different answers depending on your amount of risk. So this is going to drag on for a while. You're right. And then I would say it's not going to be until we really have some big steps forward that we're going to go back to saying, everything's normal again.
Okay. I'm going to have two more questions for you.
Okay.
One is, what about kids with CF? Do we know how they've been faring with this?
Well, so so we have some reports of people with CF who are kids who've done well. And I think one of the common questions are somehow kids with CF, they do not have to worry about this. I don't think that's the case. We know that even now that we've seen that kids, whether you have CF or not, can get COVID-19. And so until we know more about this, until we have more experience, I think we're going to have to be extra careful. There's no evidence, I would say, though, that people with CF are more susceptible. It just means that we can't be cavalier about this, and that the same protections that we're giving for anybody, we're going to have to do even more for people with CF, even the young kids.
Okay. And the last one is, we have talked about all kinds of things, and a lot of these are very difficult. I think they've really been difficult for everybody, especially those of us with CF and our families. Give us some reasons to be optimistic. What are the good things?
Well, I like that last question. Thank you, James. I think, one of the things we can say is be confident we are going to get through this. This is something that we're in together. We are going to get through this. We just have to realize it's going to take a little while. I think there's one thing that I would say in some ways that we're a little more control here than we are oftentimes with CF. One of the things that's can be so frustrating as a person with CF, as somebody who's cared for a lot of people with CF, is you can do everything right and still be having not very good outcomes. This is one, if we do everything right, we can be very hopeful that we're going to have good outcomes. The likelihood is high. So that's one thing. I think we can be in control of some of this. It's just going to take a while. We have to be patient. The other thing is we're in this together. We've had a history of the CF community drawing together to support each other. The CF Foundation is going to be here to continue to advocate and to support the best we can. And together we will absolutely be able to get through and get to the other side.